with Stoker Mtume, who's going to be showing her video and talking a little bit. Go ahead, Norma.
I grew up in Los Angeles in a poor neighborhood. From childhood to early adulthood, I received some basic primary care at a local doctor's office. However, when we didn't have insurance and cash was low, it was off to the old county hospital where a basic visit could take an entire day. I remember traveling a long distance to see a doctor, especially for specialty care. We would take 3 buses to get to the hospital and the clinic until a county facility was built in our more immediate community when I was 22 years old. I remember smaller local hospitals where my siblings were born and some county clinics, but they didn't provide the care we needed. Only recently did it dawn on me that many black doctors lacked the admitting privileges in major hospitals. Consequently, after providing prenatal care and other care in their offices, they sent their patients to hospitals where they were allowed to practice. I have been interested in the body and numbers for as long as I can remember and preferred math and life science in school. I love physical education and running street races with the neighborhood kids. I decided that I wanted to teach math and physical education when I grew up. Consequently, I began Cal State University at Los Angeles with a physical education major and a math minor. As time went on, I realized that it wasn't just the body I was interested in, it was overall health. Not much had changed since I was a little girl. I wanted to help make a change to ensure poor people could be well. In my sophomore year, I became involved with neighborhood social services and helped to start and direct a free clinic in South Los Angeles. My interest grew to include a more holistic approach to health care, and I returned to graduate school to study more about health and mental health. During my career, I helped to establish and serve in leadership for 2 other community medical and behavioral health clinics in Los Angeles and Berkeley, California. 8 years ago, I became involved with Charles Drew University and the University of California at Los Angeles Medical School's research endeavors around community engagement. I was invited to work with the schools and their students to help them develop best practices to engage with their patients in the community. I work with basic science researchers who are hard at work looking for causes, developing treatments, and hopefully finding cures for many illnesses and diseases that plague our poor and under-resourced communities, like those in South Los Angeles. Here, research is being conducted with and not on communities. As an individual with a diverse background, I participated as a full partner on non-traditional research teams in what is called community-engaged research. I serve as a community representative on advisory boards that oversee the overall projects. I have conducted interviews, facilitated focus groups, and participated in planning events to disseminate research results back to the community. Unfortunately, things still haven't changed much since I was a child regarding poor health outcomes in my community. Poor people still have the highest rates of disease, disability, and preventable deaths. For instance, the decrease in smoking cessation rates across the nation still are not translated to lower rates of tobacco use in African American communities. My work over the last 8 years has culminated in my latest project, where I will be working with a research team to implement smoking cessation services in Los Angeles County mental health and health services clinics. I no longer consider research as something mysterious, but as something that warrants my attention and involvement. I work now to help with educational and health systems change to reverse these trends to ensure a longer and better quality of life for those in my community. Health science research studies are important because they help us to better understand illness and disease and what preventions, interventions, and treatments might work best for various populations. Most community-engaged research is paid for with your tax dollars, so why not join me? Learn more. Get involved.
I want to help us to set the stage better for what we'll be doing today, the information that we will be receiving, and how the information that we're going to share today might relate to the patients and clients that we're serving, and what we'll do with the information after this convening. Many of you who have attended our training and smoking cessation symposiums in the past have heard parts of what I'm about to say. I continue to repeat it because my family and others in my community continue to suffer from illness, disability, and preventable deaths that are primarily caused by smoking. I've spent most of my life and career building and helping to run nonprofit organizations in South Los Angeles and similar communities. By similar, I mean communities where health disparities abound. As you are all probably aware, smoking has been shown to have a direct causal or significantly exacerbating effect on many illnesses and diseases. Moreover, research shows that smoking can be detrimental to all systems of the body. As community engagement advisor, my key role in this project is to help ensure that we keep the real goal of our work at the forefront. We do the work we do to help our patients and clients have a better quality of life. Bottom line, we want to help save lives. But some days I feel like I'm a casualty of trauma and disparities myself. And these are some of the reasons. My maternal and paternal grandmothers died from strokes, and one had diabetes. One of them smoked. My mom was killed in an accident while working for LA County. An elevator crushed her. One brother was murdered about 6 months after my mother passed away. Another brother, a smoker, died from colon cancer after a botched surgery while he was incarcerated. He was a smoker. One more brother had a series of strokes, and we suspect it was a stroke that caused him to crash his car on the freeway one day, and shortly afterwards, he died from internal injuries. Oh, and I'm just getting started. My sister died at the age of 50 about 7 years ago. She had Parkinson's, diabetes, high blood pressure, and asthma. Did I say she smoked? Her husband passed away 3 years ago from cancer. He was a smoker. And I haven't even touched on the mental health and HIV/AIDS cases in the family and dear friends, most of whom also smoked. My dad, who was always my biggest cheerleader and hero, died from lung cancer 13 years ago. In 6 months, I watched him go from a robust 185-pound, fun-loving grandpa to 95 pounds and too weak to stand on his own. He covered the mirror in his room because he couldn't stand to see his own reflection. To emphasize the addictive quality of nicotine, he had 3 heart attacks before he quit smoking. But by then, unbeknownst to any of us, the lung damage had already occurred. Also, one of my dearest friends since 7th grade died 2 years ago after a bitter battle with lung cancer. She smoked and had the hardest time quitting. And this year, I add another casualty. My first cousin and childhood playmate was placed in the hospice care last year. A couple of weeks later, she passed away. She had lung cancer and smoked. And now I have to add to this list my bonus mom, my stepmother, who was in hospice care for the last few months. She passed away 2 weeks ago. She was a smoker who stopped some years ago, but she also smoked for a long time. She previously had kidney cancer and lost that kidney. So you see, my work with this smoking cessation project is personal. I realize that I'm but a step away from being one of the statistics we're here about today. And I want to help see that others don't have to watch family and friends suffer and die from smoking-related illnesses as I've done. The best plan is to prevent ever starting to smoke. The second best plan is to intervene as soon as possible. And I believe that integrating smoking cessation services into medical and mental health clinics in Los Angeles is moving this county in the right direction. I'm proud to be a part of this team and look forward to better outcomes for patients struggling to change their behaviors around smoking. I figure that I must still be standing and have great health at 73 years old for some reason. So I continue to do this work. Again, thank you for joining us. Dr. Freeman?
Thank you so much, Norma. A very moving story, and you're a hero. So a lot of thank yous today, and we're running a little late, but we want to especially thank the TRDP grant program. Norma's an amazing colleague and just quite a person, a hero to me. Brianna Lopez organized most of the event today. I actually saw Brianna 4 times in 4 different stages of her career in Norma's video. Atul Nakasi is a faculty member at Charles Drew. He's going to be introducing our keynote speaker. We especially thank our keynote speaker, Priscilla Callahan-Leon. Chinita Hughes-Halbert's going to be giving a talk. Karen Beard, Laura Ray, Rishi Balani, Our panelists include Manuel Kempa, Christopher Abernathy, Rebecca Taflion, Serena Goodlet. We thank the Friends Research Institute. The CME and CEs are provided by UCLA ISAP, and Brandy Oser is going to be talking about them later today. Beth Bertaski, Gloria O'Neill, and Kimberly Valencia are good colleagues at UCLA ISAP. And we especially thank the participants. We have a great crowd today, and we're already seeing some nice dialogue on the chats. The process is basically, we'll go over it at the end of the day here, but you either ask for CME credit or not. You need to pass the test. If you do want CME credit, you'll get your certificate of a CE or CME certificate in 6 to 8 weeks. You'll get your certificate of attendance if you don't need CME credit. This is the evaluation form. We'll show this at the end also. You need to fill out the evaluation to get this. We'll also put this link in the chat and send it by email. If you complete a follow-up survey, you'll be entered as drawing for a gift card. And then you need to take this GPRA test at the end. You need to get 80% or higher.